His Royal Highness Prince Al Hussein bin Abdullah II, the Crown Prince, may God bless him, chaired a meeting for the National Policy Council where they discussed the developments in relation to the COVID-19 crisis and the measures and actions taken to address it. The Crown Prince stressed the importance of coordination between the different parties and entities in relation to the decisions taken, and the importance of not to announce any decision unless and until it is formally declared in order to avoid any confusion. His Royal Highness also reiterated the importance of scaling up random testing to detect COVID-19 concurrently with the reopening of different sectors of the gradual reopening of industries, since this is the most effective way to detect the pandemic and the most effective way to control the cases revealed. The Ministers' Council conducted a meeting chaired by the Prime Minister, Dr. Omar Razzaz, today, where they discussed the mechanism of resuming the businesses that were interrupted because of COVID-19 and the methods of supporting the sectors and industries that were damaged over the past months. During the session, the Tourism Minister suggested a set of recommendations in relation to methods to mitigate the damages that were inflicted upon the touristic sector, including a mechanism to support facilities and to inject liquidity to this industry and to address the damage that is inflicted upon the workers in this industry. And it also included the preparation needed to restore local and domestic tourism gradually, and the decisions related to this matter shall be announced next week after completing and finalizing some administrative and legal measures that are related to them. The Minister Councils also viewed the report of the committee on considering the applications for foreign funding, which was interrupted for a month as of the beginning of the pandemic. The report stressed that the committee resumed its work through teleconferences as of April the 27th, 2020. And indeed, the Ministers' Council approved a number of projects, especially the ones that are expected to be of a positive effect in mitigating the impact of COVID-19, in addition to a number of projects that will be sufficient and that will generate income to pay the salaries of staff at the civil society and community-based organization. The said committee shall announce and publish a detailed brief in which it clarifies the mechanism of continuing to apply for funding. We've been receiving questions as to the dates of reopening some facilities and public places, churches and mosques and nurseries and so on. And here I would like to mention that the Minister of Health submitted recommendations to the Ministers' Council on behalf of the National Committee on Epidemiology. That includes the reopening of these sectors gradually and at different timing, following strict preventive measures. These recommendations are being studied, and we shall announce the decisions in their regard very soon. In the framework of the government's reviewing the measures and the actions taken to organize university education during the crisis of COVID-19, His Excellency, the Prime Minister, issued an amendment on Defense Order number 7 of 2020. So the results of students will be either passing or failure, and that is for the courses that are being studied during the period in which the defense order is enforced. This is for students of medical schools in 4th, 5th, and 6th year, and for the last 2 years in the dentistry college, without the approval of the student. However, this will not be included in the GPA of students. This amendment has been published in the official gazette today. The Prime Minister also issued a circular stressing that the official departments, courts, and executive departments shall resume their work on May the 31st. The suspended terms and legal statutory periods shall resume as of then, noting that the civil servants' working hours will continue as planned and as prescribed by the guidelines of the reopening of businesses and as per the circular issued by the Civil Service Bureau. We remind you of the comprehensive lockdown during Friday on May the 29th, as usual, following the same mechanism that has been followed till now. And for this lockdown, we will give some exceptions for media personnel whose nature of business require them to go out of their houses during the curfew, and the Media Commission shall announce a detailed brief explaining how to apply for this permit and how this permit is granted. Dear citizens, we are following the debate through the media and the media outlets, the questions that some have as to the standards that govern the decisions to reopen industries or to continue to close others, and the standards on which we base our decisions to continue the lockdown. And we follow your comparison between us and other countries. And also we give the utmost attention for your queries about the times during at which the churches and mosques and gyms and the nurseries will be opened, or the restaurants and cafe and other facilities. And I would like to mention that the state institutions related to that are working in addressing this unprecedented health situation are working in order to safeguard the health of citizens and at the same time manage the essential and vital industries. Since day one, we adopted a roadmap that include measures, gradual measures, starting from a complete lockdown to complete opening. And we closely follow the measures taken by other countries to learn from their lessons. To learn lessons from their experiences. And now the roadmap we follow is based on a comprehensive integrated action plans of gradual measures and actions that govern the level of actions to be taken with every level of epidemiology. And that is based on models, international models and studies in relation to dealing with COVID-19, at the same time considering the specificity of Jordan. It is based on scientific standards and social and economic inputs. This action plan is the thing that governs the decisions in relation to reopening industries or closing them if the epidemiological situation calls for the same, and they include a spectrum of actions and measures that are adopted in a flexible manner and in a manner that is reflective to the that is responsive to the epidemiological situation. This action plan has 5 degrees of actions in relation to dealing the crisis, opening industries and reopening them, closing them. So they are gradual between the complete close down to complete opening, and each step between these two ends depend on indicators related to the national epidemiological situation and the local epidemiological situation in the governorate, and also it is related to the specificities of some industries. Actions where businesses were prioritized according to how essential they are. The first group is the basic businesses that are essential for the sustainability of life. The other includes important activities but can be closed down for a relatively long period. And the third is actions that have, and businesses that have social nature. May God bless you, bless this country, and may God protect this, the leadership of this country. May God protect the whole humanity from this pandemic. We are at your service, and we succeed if you comply. Thank you very much. Good afternoon. Today we had 2 cases of COVID-19 positive. One is for a Jordanian lorry driver at Al-Amiri border post. The second is of a child. She's 1.5 years. She's with her parents at the hospital, Prince Hamza Hospital. Both her parents were admitted yesterday. Today she was tested for the second time and she tested positive. And she's in a good health situation. And 7 cases of recovery have been registered in the kingdom. The thing that makes the total number 486. However, the total number of cases is of COVID-19 since the beginning of the pandemic is 720. 3,000 tests were conducted today throughout the kingdom. And the epidemiological tracing team shall intensify the sampling after the end of, after the Eid holiday. And here I would like to stress that some are deliberating and sharing some wrong, confusing information through social media. They are wrongfully labeled as scientific information, but they are far from being scientific. Information such as discovering a treatment, in an effective treatment in a country. In fact, this very country had 29 deaths because of COVID-19 yesterday. And some say that this is not a virus, rather it is a bacteria. And it is about blood clotting, which is 100% wrong. And no scientific medical authority has mentioned that. Some are skeptical and mentioned that there's no virus whatsoever. This again is wrong. Just like those who claim that the earth is flat rather than global. The virus is there. We know its genetic composition. In fact, we in Jordan analyzed the virus and we know its genetic composition and we know the different types that are there in Jordan. And some rumors mentioned that the vaccine will have nanotechnology in order to control our brains. In fact, this is much of an underestimation of the Jordanians' level of intelligence. And please do not share this information because they are far from being correct. And these, in fact, hijack our sacrifices. These rumors hijack our sacrifices. We stayed at home for 3 months. This is why our numbers are few. 720 cases since the beginning is much less than what is being registered in a country in 1 day. And the deaths there are in the thousands. Some may say there is no virus. Yes, our numbers are little, but there is but the virus is a very dangerous, serious illness that is hitting the whole world. Read the WHO reports. It's a very deadly illness. We should not forget that the threat is there and that physical distancing is needed, using the mask, washing hands, not avoiding contact, avoiding gatherings and crowded places is the thing that protects us and protects the country. As for the recommendations of the National Committee on Epidemiology, which is a much revered committee, the members are renowned experts in epidemiology, all have international, national, and local reputations. We work with them day and night. We study their recommendations, and until these recommendations get to the implementation phase, they go through different stages, including implementing the health measures that protect citizens, the possibilities or the methods of implementations, and so on. All of these are taken by decision makers. So once these recommendations fulfill all the requirements that protect citizens and protect us all, I would like to say that this is an institutional operation that we all do hand in hand in order to protect our country. May God bless you, may God protect you, protect this country and its leadership, and peace be upon you.